We are back with another mental health podcast for this month, and our topic today is low mood and depression. So if you can relate to any of these, you can comment, you can call in, you can speak to me and Joanne. So I'm just going to bring on Joanne now to talk. How you doing, Joanne?
Hi, good evening, everybody. Evening, Jay. I'm good, thank you. I'm good. How are you? Hot, tired, but good. How are you?
Hot, tired, sweating, and yeah. Yeah.
Yeah, I think it's all good. It's all good. So, how's your week been, Jay? How have you been?
Well, we spoke about this, didn't we, before we went live, and I said to you, like, it's a good topic to talk about this one because low mood, it's just you don't really know the ins and outs, and like with that kind of topic, I did a bit of research on it, and I can relate to some of these symptoms that I've had this week. So, like working long hours, the heat, the children are off school, it's all like stress and stuff, and the transition of my shifts and doing the YouTube stuff and that, it takes its toll on you lot mentally. So, I did a bit of research on on some symptoms that you can have with low mood, and if it's all right with you, I might to read them out, John, and then we'll break them down. But are you okay as well?
Yeah, I'm good. I'm okay, Jay. Thank you for asking.
Cool.
I am. But yeah, so what was it you've looked at? What symptoms you felt this week?
So in terms of the low mood, persistent sadness, loss of interest. I could have had a bit of number two, so loss of interest. I mean, probably just going through the day like in the week, but that's probably just because I'm tired, and like we spoke about with the heat and not getting enough sleep and stuff. You're not getting your normal 8 hours and that. It is quite muggy on a night, isn't it? So that's probably why. Like I'm happy and everything. It's just so that's probably that one. Feelings of hopelessness, changes in sleep pattern, which is what can be a knock-on effect for number two, what we spoke about. Appetite changes, so significant weight loss or gain due to changes in appetite, such as eating too little or too much. Fatigue, definitely, that's one I've had this week. I have been really, really tired. Difficulty concentrating, I have had a bit of that as well this week. Anger as well, being irritant, so increased irritability, frustration, or angry outburst. Physical symptoms, unexplained physical issues such as headaches. I have had some headaches, but again, have I been drinking enough water because of the heat and stuff? So that could be that one. Digestive problems that do not have a clear medical cause. Thoughts of death or self-harm. So those are the ones that I've been researching on. But a couple of those I can relate to definitely for this week.
Yeah. The thing is, there's a difference between sort of low mood and clinical depression. They're very different in terms of, because we all have low mood and down days and down times, and that can last for a few days, or it can be circumstantial based on things that are happening. So that's very different to depression. So depression is more defined, it's quite complex, and it differs, and it's it widely differs between person to person.
Yeah.
It's when these symptoms that you've mentioned are more, so it's kind of low mood, hopelessness, the things that you've mentioned, low self-esteem, feeling tearful or feeling angry, irritable, all those, lack of motivation, lack of interest in doing things. I find it difficult to make decisions. So all these things that you've mentioned are definitely types, definitely come with depression. But equally, it's about the length of time. So if you're having that for a reason, if you've had a relationship breakdown, or if something's happened, or even if you're having it for a shorter period of time, it's not necessarily clinical depression. It can be, how you're feeling, a low mood, so it's just to identify that Obviously, you get low mood with depression,
Yeah.
but the actual diagnosis are two different things. So we all have low mood, absolutely. But
Yeah.
that doesn't mean to say that you've got depression.
Yeah.
What the difference is, although the symptoms can be very similar, and we've highlighted a few, is, as I say, it's the length of period. If you're feeling like that for a sustained amount of time and things are not getting better at all, then it's more likely to be that it's depression. But as I said, always speak to your GP, whether you've had low mood for a few days and you just feel something's off, or whether it is longer term. Always just speak to your GP so you can define which is which.
Yeah. So I mean, I just want to clear up something here, John, if it's all right with you. So, like, say for example, it's the first time that I'm experiencing depression, or like, I don't really know. So back in 2014, when I had it, and I come through the back of it like within a few years. Obviously, this is why I do this, I like to talk about it, and this is why I'm so passionate about doing this, to get people to talk about it, because it's nothing to be ashamed of at all, and it shouldn't be a taboo subject. But if someone's going through something that they're really struggling with, and they don't know if it is a mental illness or something physical, is it worth going to the doctors first and then going to see a counsellor or a therapist, or vice versa?
Always. I would always say speak to your GP first. Always, yeah. Because, like you said, you can get a lot of physical symptoms with depression, but it's always worth getting those checked out.
Yeah.
And the GP can determine whether it is, like I say, something physical or circumstantial, or whether you they'll recommend a counsellor if you need one. So my advice would always be contact your GP first.
Yeah. Okay. So that's great that we cleared that one up then, because sometimes people don't know what route to take, do they? I mean, I did do that route. I went to the doctors first because I didn't think at the time in 2014 when it happened that I was mentally ill. I wasn't aware at first, up until like it started to carry on, like you said, like when things don't get better as the weeks go on, in terms of like the low mood topic we was talking about, like it wasn't getting any better, so that was affecting my mental state. And then that was when I was like coming to terms with that I was depressed. And then like you start having these physical symptoms that makes you go to the doctors, and that's what kind of happened with me, like back then. But it's just crazy again what your mind can do.
It's a matter, of course, because your brain controls your body, doesn't it, and all the chemical releases and everything. So it's always important, as I say, to just get checked out. Anxiety, depression, low mood can create lots of physical symptoms, but it's always best to get checked by the GP to make sure that it isn't anything else.
Yeah.
And he can determine as well what it is, because, like I say, depression's so complex. There's so many different types. There is the low mood on its own. There is clinical depression that often comes with anxiety. There can be postnatal depression.
Yeah.
Seasonal affective disorder. People have depression, but it's only in the winter time. There's a lot of girls that struggle with PMS, and so every month that can cause a low mood and depression.
Yeah.
There's bipolar disorders, so people have highs, but then they have the low again. So it's quite a complex and varied topic, and there can be lots of triggers, lots of reasons, and lots of things are different for everybody. So as difficult as it is, I know, to get in, see your GP, but he's the one who can diagnose, and then if you can determine the best course of treatment, whether you go and see a counsellor or speak to your family and get support, phone a helpline.
Yeah.
Whether you do or don't want medication, but your GP can diagnose and then determine and give you your options for the treatment.
Yeah. I know what you mean. So, for someone that's qualified in that department like yourself, Joanne, for people that come to you, like how how easy is it for you now, like with the experience that you've got now, to define the difference between the two and speaking to the people, getting to know the people, to determine whether it is just a small course of low mood or it is in fact a bit of both, or it is depression? So, like, how do you define the difference? Because the symptoms are quite similar, aren't they?
They are, but it's more again about the person, because as counsellors we can never ever diagnose. So it's more, we can never diagnose. That's why we always say first port of call is to get professional medical help,
Yeah,
in terms of your GP or 111, or going to your local clinic, whatever works, wherever you can get an appointment basically. But that's the first port, because as counsellors we can't diagnose.
yeah,
Obviously when people come in, we have an awareness, like you're saying, an experience, and we can then look at the person, get to know them, and look at what course of treatment, how we can best support. But that comes from actually knowing the individual and their circumstances. It's always looking at the case individually.
yeah,
So
definitely.
what would work for you in one counselling session wouldn't work for me,
Yeah,
because we're very different. Our view of the world is very different. Our low mood will be very different. So it's in therapy, it's about what we do is we get to know the person,
yeah.
and then look at the treatment plan that can best help them based on them as individuals. Does that make sense?
Yeah. Because when we spoke about it before, and I mentioned when I went to speak to a counsellor, they kind of break things down and they just get to know you, don't they? And they ask you a lot of questions about your life and stuff, like even as far back as when you're a child. And they're kind of like, they're basically just the puzzle finishers, aren't they? So they put the puzzle together to break down everything, and they do this by getting to know you, don't they? So they can find a root cause to what potentially started it subconsciously.
That's absolutely it. That's it, Jay. And he's looking at, we do, like you say, the root cause. We look at a historic patterns, experiences, what's happened to that individual, any trauma, childhood, and it all combines.
Yeah.
And then, like you say, that is literally, you come in and you give us all the pieces. You give us the pieces by just talking about how you're feeling, what's going on. And then we put the jigsaw, we put the pieces together as a counsellor, and then help you get to where you need to be.
Is there any like kind of like workshops that you do and stuff, like, Joanne, for like people to, so like if they've spoken to you and you determine what the root cause is and what it actually is, like for example if it's lower mood or like depression, what kind of things can you like recommend to people that are going through that, or like things that they can do to help distract their mind from it? Because it is your mind, isn't it? And like we spoke about, that your mind's a powerful thing. You're just learning to retrain your brain, aren't you? You're just learning to reprogram it, aren't you, to get better?
Absolutely. But it's also, don't forget, it can also be, if it's sort of a clinical depression, again, that's different to low mood, that can be a change in the chemicals within the brain. So it is like a reduction in serotonin and that type of thing. So it is a physical thing as well. But there are lots of things that can help. The trouble is that there is a block, because when you're low mood and when you're depressed, you don't actually feel like doing anything.
Yeah.
So it's really hard to make the changes. So to start with, the best thing to do is make small changes. Routine's fantastic.
Yeah. Getting a routine.
Yeah, so people with low mood don't want to get out of bed, but if you can force yourself out of bed the same time every day, try and get a routine. Those small things can make a big difference.
Yeah, so like getting up the same time, making food the same time, that kind of.
Absolutely. Absolutely. Routine's key. That can make a big difference. The other thing that there's a lot of medical proof with this as well is the exercise.
Yeah.
So that doesn't mean you have to suddenly become a gym bunny. It's not that. Even if it's just a 15-minute walk around the block,
Yeah, getting a bit of fresh air as well, isn't it?
it's that is changing, because it changes. You know, there's evidence with this. It's a really good therapy, because what can happen is it changes all the endorphins in the brain. So even if that just for those 15 minutes you're feeling a little bit different, and for a little while after, it's a start. So it's thinking about small steps. When we have low mood and depression and our motivation sinks and we don't want to actually do anything, everything seems too much. Going back to work or going for a run or anything just seems too big. Even having a shower some days is too much.
Yeah.
So it's about starting small, just trying to keep your routine and do something small, just little baby steps. So take that shower or just take that 15-minute walk, just something slight day to day. And then as that builds, as I say, there can be a shift.
Yeah, definitely. I mean, I used to, because I was like pretty much bedridden. I spoke about this, like, I couldn't face it, or I couldn't leave the room. So like when I did force myself to do it, I used to sit down on a night and I used to write down a list of things what I was worried about. That was just completely just irrelevant. So like I was worrying about not worrying. That was the worst one, because I was that used to worrying about stuff that really I didn't need to worry about. But it was just that adrenaline rush. It was like my body. The best way that I can describe it is when you're anxious, you have a panic attack and all that, you get that rush, don't you?
Yeah.
And I was at a point in my life where I felt like my body needed that. Like it was like like an addiction to that feeling. So like even though like I didn't want it, I was that lost in my own head. Like, that's how I felt. So like when I tried to force myself to do, to take the shower, to get out of bed, to do the walk, I used to sit down on a night and I used to write down all the things that was in my head, analyze it and go, right, do I really need to worry about this? And what I'd do was I used to scrunch the list, go through the list, things that were relevant and things that were not relevant. So I used to scrunch them all up and I used to just throw them away, and that would help. And then I used to program my mind to think that when I go for a walk, it's kind of like a reset, and I'll leave it outside the house. You know what I mean? So when I come back in the house, that kind of like helps relieve stuff as well. So that was a real good way.
Brilliant. That's it, and that's the thing. It's brilliant. That's brilliant. Journaling, writing things down, like you say, looking at what we can and can't control. But always, what's really, really important to say is, obviously, don't be alone in this. Like we say every month with whatever mental health is, if you're really struggling, there's people you can phone.
Yeah.
There's support groups out there. Talk to your friends and family. Don't sit with the depression on your own, because it won't help. It's better to get the support to talk.
Yeah, definitely.
And the other thing, just to highlight, like, as much as we need to do things to sort of help ourselves, and like what you're talking about, you did, it's equally, there's no pressure or no, what's the word? It's kind of, we don't have to force ourselves to be positive. This fake positive that people, we've got to put on our best face and be absolutely amazing and everything's perfect in the world, and put on this false sense. We mask. A lot of people mask, and they'll say, I'm fine, or put it on and then go home and they're in absolute bits.
Yeah.
So I'm all for helping yourself and having a different outlook, but when you are depressed, having people say, oh, pull yourself together, or actually be positive is the worst thing you can ever say.
Definitely.
Because people aren't choosing to feel this way. But it's how they're feeling, and what's needed is just support and someone to listen.
Yeah.
And then, like we said, create little coping mechanisms, as in going for a walk, having a shower, just routine, just those things to start with first off.
But those small steps though are massive, aren't they, Joanne?
They're huge, but they make it. That's it. They're huge steps in terms of and the difference they can make.
Yeah. Yeah, 100%.
And just to say that, like this, you know, you can ring if you can't get. I always say go to your GP.
Yeah.
If you can't get through, you can ring 111. If you're really struggling and really, you know, you feel you're at risk, you can ring 999. That's fine too. You know, and there's other support groups out there. You can look on the NHS websites or Google, but Mind is a really good one. They've got a 24-hour support line.
Yeah.
And I'll give you the numbers: 0300 102 1234. So it's 0300 102 1234, and they're there 24 hours, 24 days, 24/7.
Yeah. So there you go. So if anybody is watching, there is a number there that you can get access to that is 24 hours.
And there's the Samaritans. There's lots of places you can go and lots of support out there you can get, so you don't have to struggle with this on your own.
I'm just from my personal experience. I mean, I was 21 when it happened, and I'm so glad that I went through it, because it's helped me to do this. Like, I'm so glad that I suffered. It was worth suffering for those 3 or 4 years to do this, and to be able to come out the other side of it. And this is why I'm so big on it. Like, you know, and people go through things, all walks of life, different stages in the life. But from my personal view, I'm glad it happened to me at a young age. How hard it was, but to also be able to deal things later on in life as well. To, you know, because things do happen, don't they? With like relatives, friends. You know, as you get older, things tend to happen. Work as well, and there's all sorts, isn't there? So like, it just kind of helps you to deal with things a bit easier.
You're working wonders, Joe, because of your journey and then what's come out of that. And, you know, you're helping so many people off the back of your own experiences. It's amazing. It's just absolutely amazing what you're doing.
Thanks, Joanne.
And it's always, you understand what it's like, as do I. You know, as I've said before, I became a counsellor through having my own counselling.
Yeah.
You know, and so when you understand, as you do, from going through it, it gives you a different outlook, doesn't it? A different understanding.
Well, yeah, because you can relate to it, can't you? I mean, I suppose if someone's like a qualified therapist and they haven't gone through anything, I mean, does that affect their skill set in terms of identifying and recommendations for that person that they're seeing? You know, their patient. I think someone who has gone through it.
Yeah, I think obviously there's fantastic therapists out there either way, but for some clients prefer to know that the counsellor that they're sat next to, confiding in, has got some experience of it themselves, or whether they haven't. You know, not everyone, we don't self-disclose regularly, but equally sometimes when you doing an assessment, a client might say, you know, have you ever been through anything? Because it makes them feel it's more relatable.
Yeah. I understand with that one. Do you ever get many people that ask, Joanne, or?
The few, like not everybody, not, I mean, probably maybe say 1 or 2 in 10.
Yeah.
But there are people out there, and it does seem to make a difference. You know, they do want to know a little bit about me. That it's like, and that's something else to remember when you're going to find a counsellor. Like, interview them. You know, like because you've got to find the right person for you and the right fit. So when you're trawling through trying to find a counsellor, it's not about necessarily whether they'll see you. It's as a client, as yourself, as you go in. It's about whether the counsellor works for you. You interview them. You ring the counsellor up and ask them questions. Make sure that they're the right fit for you and the right match, because then you'll know you'll get the best from therapy.
Yeah, that's definitely answered that question, Joanne. Thank you. I'm just going to, should we turn the phones on, John, in case anybody wants to call in and stuff and speak to us? So you can call in if you do want to speak to us, guys.
Absolutely.
Just there we go. The number should be on the screen now. So if you do want to call in, anything that you've gone through or you're going through and you haven't spoken to anybody, you can call in. We're not here to judge, we're here to help. This is why we do this. And yeah, I won't be able to do this without you, Joanne, as well. So thanks for doing this for me every month.
Oh, it's a pleasure. You would, Jay. You're doing amazing.
And you too.
The community you're creating is just fantastic, isn't it? And all coming from your own experiences and, of course, the football.
It would help. It would help if I actually turn the phone on. I'm actually turning it on now. It is turning on now. So, I mean, have you had patients recently that have came in that have spoken about low mood? Because you have your big ones, don't you? Like your anxiety and depression and stuff. But like, has anybody actually come to you and spoke about like low moods, Joanne?
Yeah, I mean, that's really common. You know, that's a daily basis thing. Some people have come in and they've, like, the depression aside, like I say, generally they come in with something else, but they can come in and they've had a bad week or a bad day at work or a row with a girlfriend, and you know, situations impact our mood. What we do impacts our mood hugely.
Yeah.
So it's a daily theme. You know, people that are coming in, even if they're coming in with different things, that low mood is always a part of it on some level.
Yeah. What kind of life changes could affect low mood and stuff? So like work, relationships, that kind of stuff.
Yeah, everything. Home, not eating right foods, missing meals. You know the term hungry, like it's a thing. People feel low. Everything drops. Not enough sleep is a big one. Your sleep pattern is huge. That affects your mood. You know, for girls around their periods, you know, before, during, after, there's so much in, because of the mood. It's all about the chemical releases. It's all about the hormones and how we're regulating with those, and that just determines then how we feel.
I'm not sure if you know the answer to this, Joanne, but I'm going to ask you because I find it really interesting, like in terms of the chemical imbalances and stuff. So like as a professional, from the GP or yourself, like how can you tell if the chemicals are imbalancing someone's? So like, is there any kind of signs that give off that, or?
Do you mean in terms of like, so
the chemical imbalance? So like, obviously, I mean, there's people that have prescribed medication to help with those chemical imbalances. So like, how do they define that they need medication? Because that's another taboo subject, and it's one that I don't agree with when people say, oh, you know, that you shouldn't be taking medication to make yourself feel better. But I'm a believer where if it works, do it.
Absolutely. Your GP wouldn't be prescribing it if it wasn't needed. there's no set way of really, because the chemicals and the hormones change so frequently. Like I say, there's no actual test specifically to show a chemical imbalance.
Yeah.
Does that make sense? But
Yeah.
how they diagnose it is more about your symptoms. So it's diagnosed in terms of your symptoms, behaviours, and all those things that can, like we talked about, the length of time, how persistently sad you've been for so long, all that they look at that as an overview and then determine that, okay, this is clinical depression, and that, you know, that means that there's a change, that medication might be needed. There is still a stigma. We are a much better around medication, but there still seems to be a stigma. People still find it difficult to admit that they need to take antidepressants or, you know, anti-anxiety medication, but it can make such a difference. And again, your GP wouldn't be prescribing it unless he thought it could help.
Yeah. Because I was on sertraline, I think it was 50 milligram. A few months back, and then probably a couple of years after, like it happened in 2014. But you know, that's helped me in the past and stuff. Like that was a relief and stuff, and that was kind of getting you to get on the road of recovery and to try and get through it. Like, but you know, so I mean, I've never been the person to frown upon someone taking medication, because I'm a fond believer where, like, if it works, it works. You know, you do what's right for you, and like you say, like you said it yourself today, and I've always said it. You know, we're all different, so whatever works for you, just do it.
Absolutely, Jay, and that's the point. You know, it's personal preference. There's no the GP wouldn't be prescribing unless they thought they could help. So then it's up to you personally what you decide to do. But there's nothing wrong with taking it. You take paracetamol if you get a headache.
Yeah.
People take antidepressants if they need them for low mood, anxiety, depression. You know, you take antibiotics if you've got a chest infection. It's all the same thing.
Yeah. I mean, probably because it's that taboo kind of. I'm not sure if people like to talk about the fact that they're taking medication, or it's the fact that they're afraid of people will judge them because they don't believe that it's like you say, like an illness. We know it's an illness, obviously, but like some people may not believe that a mental illness is similar to a physical illness, or like a chest infection, you know, something where you need medication to, you know, just taking, for example, me, like a few years back, you know, the sertraline and stuff, like that kind of example. Do you think it's because people that don't understand are the ones to judge on that? The medication stuff?
And I think, Joe, but the thing is, people still define, some people, not everybody, we're getting better, but mental illness as something different to a physical illness. But your brain is the main organ in your body, so it's no different. It is a physical thing.
Yeah.
So we all have mental health. It's not something somebody else has. We all have mental health. Some people have better mental health, have good mental health. Some people at certain times is poorer. You know, it fluctuates, but it's something we all have. It's just the degrees that vary. So somebody else, like I say, can have good mental health. Another individual can have depression. Another individual might have anxiety. Another individual might have bipolar. Because we're all unique and we're all individual. You know, our experiences are very different, but we all have mental health. It's not something somebody has who's poorly.
Yeah.
Everybody has it. And I think that the more we can become aware of that and the more people can accept that, then the more mental health as a whole will be judged differently.
Yeah, I agree. I was going to say as well, Joanne, like in terms of the medication side of it as well, when you speak to people and they open up and stuff. There's been a couple of people that I've spoken to, like in the past few years back on it, and that some people want to take the medication to help, but they're afraid of not being able to get off it, like dependent on it. Like, is that something to be concerned about, or is that something that's quite often spoke about, or
I think in terms of the medication, it's more, again, it's always done in line with your GP. It's not about that you can't come off it. It's more about that you have to come off it properly.
Yeah.
So that has to be a reduction and then monitored by your GP. So it's absolutely, you will always get off it, but it's done in a safe way.
Yeah.
In line with your GP. He'll always tell you the best way to reduce and then come off it. I think people's fear is that it makes them feel better. And then a lot of their fear comes from, if I come off it, am I going to be how I was before?
Yeah, it kind of brings that vicious circle back round, doesn't it, I suppose?
Yeah.
In that cycle again, and like you're on the road to recovery in terms of taking it. And then, like you say, like you're worried that if I don't take it, am I going to go back?
Yeah. But obviously, because it's done in a safe way, in line with your GP, you'll always be monitored. It's the right thing. I would say never let the fear of what maybe put you off taking it, because it can be, as you've learned, it can be so beneficial. But as long as it's done in line with a medical professional, then it's safe.
Yeah, bang on. Do you so like, are you partnered up with any GP? So like, do they like recommend anybody to yourself? So like, if they go and see the GP first and say, look, I've got this happening, and do they kind of send them your way, or is it just?
Yeah, the GPs, they have their own in-house counsellors, or they'll send you to talking therapies. So, in fact, you can self-refer to talking therapies as well. So that's a free service.
Yeah.
Within the Dudley Borough, at least, I know it's so you can self-refer or go through your GP, and there is a waiting list, but obviously you get the help and it's for free. In terms of me personally in private practice, I don't have any alliance with any GPs at all.
Yeah.
People just refer to me through my website or through words of mouth. In terms of NHS counsellors, they're either in-house at your GP, or your GP will recommend and give you numbers for the talking therapies.
Okay, right, yeah. I know what you mean.
Yeah, and those services, they're normally doing sort of CBT, that type of thing. But they do individual work, but they also do group work, which can be quite beneficial for some people.
Yeah.
So there's lots out there, Jai. There's so much out there. There's obviously people like myself in private practice. There's NHS counsellors at your GP. There's talking therapies. There's group work. There's online support. There's telephone support. And as I say, always, if there's anything that's different and you're really struggling, always ring 111 or 999.
Yeah, definitely. I mean, what are they like when they respond to?
They're excellent with mental health. The services are absolutely excellent with mental health.
So it is getting more and more recognised. It's not.
Absolutely.
Yeah.
Absolutely. Because, like we say, it's classed as a mental health, but equally, it's a physical thing.
Yeah. I mean, there was a time, I think it was probably around 2016, and it was when I was like halfway through it, like, and it was at the point where like I was getting out, but I still wasn't like 100%. And I remember my friends asking me, "Do you want to come and play football?" And I went and played with them, 5-a-side football, and I just remember, like, my head just went really, really lightheaded, and I just couldn't breathe. I thought I was having a heart attack, but it was actually a panic attack. But I went outside, and in the end, I had to phone an ambulance. But like, I had to come away from my mates and just walk like completely away because I didn't know what was going on, and I was just breaking down because I wasn't like, what's up with me? This ain't me. And I just remember like just crying on the car park, just waiting for an ambulance to come out the door, like the surveyor and all the checks, the ECG stuff, and I'm like, you're having a panic attack, mate. So back then they were quite good. They was really reassuring, but that was a good example of during the. But like I felt really guilty though, so that was like back to the vicious circle. I feel like I'm wasting your time because there's people that are having heart attacks and stuff, and you've come out to me, and I'm just having a panic attack. Do you know what I mean? But it was raw to me. It was new, so like I didn't quite understand the panic attack like then. You know what I mean? So it was, but it is kind of like similar symptoms, I suppose.
It is, and I'd rather you phone and and get checked than doubt. It's always better to get checked.
Yeah, but there was really good, like the talking to him and stuff. There was like, no, you're not wasting our time, and like you say, we'd rather you call. But I just felt that that there's people that genuinely could potentially be dying, and they've come to me, and I was just having a panic attack. But that's how I felt in my head. It was guilt alongside with that as well.
But you weren't to know that it was a panic attack, and that's the thing. So you did the right thing.
But that's just an example that I wanted to talk about because that's what happened, and in terms of the NHS and the system then in 2016, it was really good. But I don't know what it's like now, but I know that there's things you read online saying that there is still a lot of work to do in terms of the NHS understanding more of mental health and stuff. So I don't know what the stats are now or
The thing is, obviously, everybody's stretched, aren't they? Everything's at full capacity. That's why it's hard to get a GP appointment or hard to. But the thing is, when you do, like the people that work in this area, they care. Like you're saying about the paramedics, they'll get to you and they're not going to be funny. They're going to look after you.
Yeah.
There's some really, really good people and that understand.
Yeah. Yeah, definitely. Do you ever get like patients that come in that have dealt with the numbers that we spoke about, like the 999s and stuff, and they're opening up to you, like in terms of that? Is that quite common? Joanne?
Yeah, lots of people use the different services that are out there, and that's really good because that's what we want. We don't ever want anybody to go through this alone.
Yeah.
Especially if you're feeling that low. Because then people, like you touched on earlier about self-harm or think of ending your life, when you get to that point, there's always somebody there to support.
Yeah, there's always a way out. Always. I'm a firm believer of that. There's always a way.
There's so many charities. And again, like I say, if you're not getting much luck with, if you don't want to go through other services or you're not getting much luck or it's in the middle of the night, just if you don't, there's other charities out there that offer so much support.
Yeah. What about like anger and stuff? Is that quite common?
Yeah, like we spoke about with the anxiety, it's a part of a part of that. Anger can be a symptom. Frustration, irritability, that often comes with low mood. Really common.
That's one thing that I didn't have was anger. It was more like the emotion sides of, upset, crying, that kind of stuff.
Yeah. You had that more than the anger.
Yeah. Because it was like I was lost in my own head, and I couldn't. I felt like I couldn't get out. Like it was like the best way I can describe it was like I felt like I was trying to dig my way out from the ground, and I could see the daylight, but I just couldn't get out. Like I couldn't. That's how I felt.
Yeah, but you did. You did the right thing in accessing the services, Jay, didn't you? So you rang 999 when you thought you were having a panic attack, and you saw your GP, and you had counselling. Was there anything else that you accessed?
Acupuncture, that's one of the things. Well,
yeah,
probably say that was the best one out of all of them for my experience, just because I like all that stuff, the Buddhist and the Japanese kind of spiritual side of things. That's why I'm covered in the tattoos that are Oriental stuff and that. That's why. That's part of the reason why I'm covered in tattoos is because of that. The Buddhist stuff and all that. I'm a firm believer of like meditation and not the acupuncture's kind of like that. That was really good. It, like relaxing you and stuff, and they find the right treatments for how your heart's beating, the blood around the body, so they can tell. Like there's thousands of treatments that they can do on you, and they can tell from the circulation in your body and stuff. There's all like different aromas that they can like different smells, like with candles and stuff as well. And they're putting these needles in you and stuff, and it just feels like all that negative energy from all your pressure points is just relieved.
It's amazing, isn't it?
Yeah, but it's one of them. But again, that's another taboo subject because it's not scientifically proven. So like doctors and GPs still don't like to go down that route in a way, do they? That's off your own discretion, I suppose. But that's the kind of vibe that I got. But I was doing a lot of research and stuff online, and there's a lot of forums saying that doctors, even my acupuncturist, she was saying that doctors, they don't believe there's enough scientific evidence in acupuncture to be a proper treatment. I don't know what it's like now if they do prescribe it now, but like back then, it wasn't.
It's a bit more sort of like physiotherapists will do acupuncture and things like that. So certain areas it is a little bit better than it was, but it's still not necessarily. Well, it's certainly not prescribed in terms of mental health. But it's finding out those things that work for you because, like we say, it's different for everybody.
Yeah. Oh, yeah, definitely. I'm just saying, like, it worked for me. It was brilliant.
Yeah.
I'd recommend it to anybody, but it was brilliant.
I've had acupuncture too, and it really helped me. It really did. But again, for someone else, it might not work, but meditation might. Exercise is always a fantastic one on any level.
Oh yeah, definitely. Like you say, going for those walks and stuff and that as well. And I used to walk I used to park my car like a 10-minute walk to the acupuncturist as well. So I'd have that walk as well before I got there and stuff. So that helped as well.
How often did you go for acupuncture?
I go now. Like sometimes if I don't even need it, like I just like to go. It's just relaxing, and if you have a bit of a stressful day, it's just good to. It just unwinds. The best way I can describe it. I'm not sure if you felt the same way. Have you watched that film with Patrick Swayze, Ghost?
Yeah.
People have passed away, and like you see like the souls that are the body. Well, when I went for acupuncture, like it felt like that, like with all that negative cloud, like a silhouette of myself.
Just leaving.
Yeah, like that's how I felt. Like I felt like all that pent up negative energy that was crushing me inside mentally was just lifting out of me. Like in a couple of sessions, like honestly, I felt like a new person. Like it was brilliant.
It's fantastic, absolutely fantastic. You found your thing that worked for you.
The best way to describe it, and it probably sounds stupid, but that's how I felt. That's how I felt because they had the right pressure points. Like your wrists and stuff they put in. Like, and people like they kind of think, well, yeah, it's needles, it puts me off, but your body has got 7 layers of skin, and I think the needles either go into the 3rd or 4th layer of your skin, so it doesn't actually pierce it enough to bleed, but enough to feel it. Do you know what I mean? But that, don't they, Joanne?
Yeah, it's really, really professional. Like when you go and see an acupuncturist, they're really professional. They know what they're doing, and they know what meridians they're on. They know where to put the needles in. So it can feel amazing.
And it's like yourself as well. They've got like a client reference data. It's all professional. It's all like kept away, like our GP would have your details, and like yourself, it's all like logged properly, so no one can obviously access your details. So they've got like a build up of that person, and again, they kind of do what like a therapist would do in terms of going back to the start and talking about your life and stuff. And then again, that's another way that they can determine what treatment's right for you.
Absolutely. It's all professional, it's all confidential.
Yeah. But it was brilliant. Like, I mean, I still go like now, even if I don't need it, I'll just like going because it's just relaxing. It's like having a massage as well. I mean, I've had a few like massages and stuff as well, like back then as well, and that was just a good like reliever as well. It was just good to just, because you get physical symptoms from mental illness as well. So like I was getting like a lot of cramps and stuff, and a lot of joint locks and things like that, and knots and stuff as well. That's a common one.
Yeah.
Knots. So like when you go for a massage, they find all these and they can help relieve again, like pressure points, or like reduce muscle stiffness and cramps and aches and pains. And again, that all links in with your mental state, doesn't it? So that's another good one as well, like having a massage done.
Absolutely. Releasing that tension.
Yeah.
There's so much in exercise, walking, being out in nature. And then like holistic therapies, a lot of people use the holistic therapies as in massage, reflexology, acupuncture, because it all just helps with that de-stress.
Yeah, definitely. And I like all the scented stuff as well. So I like the incense and stuff. I mean, I've got like a lot of them. That like even like when I'm around the house and I'm cooking or something, or like I'll light an incense and just having that smell, and that's another thing that can help you as well.
Yeah, anything sensory, absolutely.
Lavender spray is a good one as well. So like when I think it was like at the start of it, so like I had real bad insomnia, so I wasn't sleeping and that, and doing again like some research on a night and that to try and find ways to try and sleep. Lavender spray was a really good one as well. So you spray like your pillow with lavender, like, and that'd
help you relax.
Oh yeah, definitely, yeah, massively. And again, like the scented like baths and stuff, like the lavender stuff. I mean, lavender's really good for mental health.
I can just see it now, Jay. You kind of, you're all masculine, all football, and then you've got your sprays and your candles and your incense and all your. Have you got fairy lights as well, Jay?
Yeah, I have. I ain't bothered. It helps me. Like it's brilliant. Like, all that stuff.
It does, and that's the thing. It's taking away that any stigma around it, because it does help.
But again, like doing this, you'd look at me and think, bloody hell, like beard tattoos and all that, and I love all that stuff. Like, honestly, get me in there.
Yeah, with your candles, your smellies, your lavender oil.
Yeah, but this is why I do it though, because again, to talk about it, but I don't care what people think of me. I'll do this because I want to help people. To talk about things and don't bottle things up, and just be yourself and find your path again. You know what I mean? And it's massive to me, and that's why I say I'm just grateful it happened to me at a young age to be able to come through the other side, to be able to do this.
It's fantastic. It's brilliant what you're doing. Absolutely brilliant. You're just helping so many people.
But they can do it, can't they, Joanne?
Say that again, Jay.
They can do it, can't they? They can get through it, can't they, with the right treatment.
Absolutely. And Jay, is it all right if I just like give you some numbers and give anybody that's listening, even if they don't want to ring in, anybody that's just struggling, like I say, contact your GP. If you're feeling really, really scared, really unwell, there's 111 999. But like the Samaritans, that's all. This is confidential.
Yeah.
And they're 24 hours a day, 365 days a year, and the people that answer the phones are there to listen and support, and most likely have been through things themselves. They're very experienced. And that number for the Samaritans is 116 123. So that's 116 123. Another really, really good charity is called Sane Lying.
Yeah.
They're open. They're only open till 10 p.m. But their number's 0300 304 7000. That's 0300 304 7000. And then there's the National Suicide Prevention, which these are excellent. These people are absolutely excellent. You've never got to worry about ringing them and talking to them. You know, if you've got anything going on like that. And their numbers, it's a free number again. It's 0800 689 5652. So they're open, the National Suicide Prevention Line. They're open till, I think it's till midnight, if I remember rightly. And their number's 0800 689 5652.
There you go.
And equally, you can talk to counsellors, you know, if you've got people in private practice as well, that, you know, if you need to go and see someone, there's so much out there, and don't be fearful of it. They're all there. Most people at the end of these phone lines are experienced and they understand.
Yeah.
So if you can't go to your family, your friends, you're still not alone. There's plenty out there. Even in the middle of the night, there's people you can phone and talk to.
Brilliant for that, Joanne. Thank you.
That's okay. It's so important, because it you know, when you're in the depths of it, you feel that it's never ever ever, you can't see the light. But
it's another form as well, isn't it? It's another way of finding something that can get you on the road to recovery and to help, isn't it? It's another way of finding. If people don't, I mean, I didn't know about like any of those, like all you said.
Yeah.
At least.
There's lots of charities out there, and like they're open a lot of the time. So they access them. You can ring up, you can chat for 5 minutes or 5 hours. They're going to be there for you.
Yeah.
And all it is with this is, when you are at your lowest, it's moment by moment, because it does change. Every moment changes, and you haven't got to think about am I going to be like this tomorrow? Is this going to be like this next week? All you need to do is moment by moment.
Yeah. Yeah.
Okay, and in this moment, okay, I'm going to ring someone, or in this moment, I'm going to have a shower, or in this moment, I'm going to lie on my bed and listen to some music, or, you know, it's moment by moment.
It's baby steps again, though, isn't it? You know, but like the massive steps, aren't they? Like you spoke about earlier, you know, they are.
It's taking those baby steps, but they will make massive changes. They will make a massive difference.
But yeah, thanks so much for coming on again, Joanne. We hit the hour mark, and I know you got stuff on and stuff, and really enjoyed talking to you again.
That's all right, Jay. That's okay. It's been an absolute pleasure. And as always, if anyone needs anything out there, again, my contact details are on there. I'm happy to chat to people also, so anyone can call, you know.
Thanks so much, Joanne. Means the world to me.
You're doing amazing, Jay.
You're part of it now, though, because you know what I'm talking about.
You're doing amazing. Everything you're doing, the boy in blue.
You're the trained one.
But you're the experienced one. And everything, all the advice you're giving, Jay, is good advice. You know, and it's through your experiences, isn't it?
Yeah. Well, I can only go off what I've gone through and the things that that have helped me. And again, I'm proof that there is a way out. 100%. I'm massive on it to talk. You know, we're not here to judge. It's a great community. Like, anytime you want to reach out to me or Joanne, please do. Just don't bottle things up. And this is every month as well. So anybody that has come to this podcast the first time, it's something that I do every month. Just one podcast a month. It's for anybody. It's not just for Birmingham fans. It's for anybody. You know, you can just come along, talk to us. You're not here to judge. We're here to speak to you. So, and just have a great community and just you know, just help each other, because teamwork makes the dream work, doesn't it, Joanne, as well?
Absolutely, but being a part of your community, letting me in, and you know, all of it, all of the boy in blue, you're all amazing, absolutely amazing, and what you're doing, it's just a lovely, welcoming community. So, anyone become a member? So hit Jay up. It's just brilliant.
Cheers, Joanne. Thank you.
Look after yourself.
And you, just let me know what date you want to do for next month.
Will do, Jay. I'll drop you a message. Let me know your let me know your rota first. Send me your rota for September.
Okay, no problem.
And we'll take it from there.
Definitely. Cheers for tonight, Joanne.
That's all right, Jay. You take care.
And
Good
you.
luck, everybody.
Bye.
Bye. Bye. Bye.